Does nicotine help protect from the honey badger virus? And as well, we have some more media malfeasance to talk about here today. Hello, everyone. This is Dr. Chris Martenson here with your SARS-CoV-2 daily update for April 27th, 2020. It's day 95 of this reporting, closing in on that magic triple-digit number 100. But let's get to the numbers first. Daily new cases, again, as we've talked about before, there's nothing really to report on a daily new case. This is Monday. This is last day through Sunday, so that red dot's at the top of Sunday. Sundays tend to be kind of low because of that Saturday-Sunday piece, right? So at any rate, we don't see a lot of change to this yet. And a couple days ago, before this, 3 days ago in this, we hit an all-time peak out here. So pretty flat at this point in time, not seeing really a lot of gain or loss in one way or the other here. And of course, what can we really put into these numbers? Not a lot, because we don't have universal testing. Not everybody who wants to be tested or should be tested can be tested. So testing is part of this as well. There's a lot of evidence piling up that we have people who are asymptomatic walking around out there who probably wouldn't present for testing. And as well, we've got a lot of confusing data from those serological tests, like the really bad one done at Stanford, but I've looked into the ones from Germany and the ones from New York. And again, I can't actually cast too many aspersions on the one from New York because the only reported number that they've put out on that so far that I can find is the sensitivity of the test, but not the specificity. So I can't even analyze what the New York serological data might hold for us at this point in time. It's just a guarantee that there are more people infected than we currently know about. All right. Does nicotine protect? Does it actually work like this? So this came out on Friday, I guess. Fearing a run on nicotine gum and patches, France has banned the online sale of the products, a move spurred by reports of a lower than expected number of smokers among those hospitalized with the coronavirus. In addition to this online ban, French authorities are limiting people who purchase the smoking cessation products at pharmacies to 1 month's supply only. So, really important to note here that smokers who do get infected tend to have more serious symptoms. Still, a Paris hospital is now testing the theory that nicotine could play some role in blocking infection, the report said. And so there's a study now where they're being given nicotine patches. But if it's going to help block it, again, anything that works to block the entrance of the virus or anything that's going to be an antiviral in any way, you got to give it early. Doesn't help. I'm going to bet you anything. If they give nicotine patches to people who are already in serious or critical condition, we're going to discover they don't do nothing. That's just a prediction. I could be wrong about that. But if this has a blocking function, you're going to want it at the front, not the middle or especially the back of the disease. So what do we know so far? Well, nicotine may protect from getting ill in the first place, but the effects of smoking may make the disease work. So if you can separate the smoking from the nicotine, this might be a good thing to do, and that's where the patches come in, where they're not suggesting people take up smoking because that harms the lungs. So maybe it's the nicotine itself, not the smoking. So separate nicotine from smoking, and I think we're onto something here. The study was kind of interesting. It looked at around 500 COVID-19 patients, of whom 350 had been treated in the hospital, 150 had a mild disease progression. Only 5% were smokers, that meant that there were 80% fewer smokers among the COVID-19 patients than in the general population of the same age and gender cohort. So that is kind of interesting. That would be pretty significant, I would bet, out of that many people and controlling for age and gender. That's a lot fewer. So this contrasts actually with what we learned out of China, which suggested the exact opposite of this. The smokers were getting it more. So we're going to have to really burrow into this a little bit more, wait to see the data. I just want to put it out there because it's out there. A number of you asked me about it. So let's look at that. The French study assumes that nicotine can protect against the new coronavirus. It's based on the hypothesis that nicotine attaches to the ACE2 receptors used by the coronavirus, thereby preventing the virus from attaching. It's an interesting theory. The virus cannot enter the cell and cannot spread in the organism if nicotine blocks it, the researchers conclude. All right, that's an interesting theory. Can't wait to see if that's true. You probably could figure that out in vitro, in silico, in glass. You'd probably can do that with a cell line and some of the virus and see if that's true. Just put a little nicotine in there, do it over several doses and concentrations in the cell media and see if that works. That'd be interesting to know. All right. Media check, NPR edition. So one of the things I've been turning to lately, besides the fact that our economy is just absolutely shattered for people at the bottom, although the Federal Reserve is doing everything they can in the U.S. to make sure that the holders of assets, that's dodgy debts, junk debts from corporations, mortgage-backed securities that should be tanking but that are being bought for more than 100 cents on the dollar by the Fed. The Fed's working really hard to make sure that the upper 0.1% of society doesn't lose any of its fantasy wealth through all of this. But we're really starting to see, just super damaging effects with crops rotting in the fields, and because they can't get to market, and total breakdown of supply chains, especially in food, as well as, small, I'll call them small little people, us, getting really harmed by the overall lockdown and cessation of economic activity. So one of the things I want to make sure is that we actually have good information coming out at all times, good lab data, good study data, clinical trial data. And also, this is a time I think our media has to be really up front and center. So here's a little media check on NPR in this case. Virus researchers cast doubt on theory of coronavirus lab accidents. This came out on April 23rd. Look at this. Virus researchers say there's virtually no chance that the new coronavirus was released as a result of a laboratory accident in China or anywhere else. The assessment, made by more than a half a dozen scientists familiar with lab accidents and how research on coronavirus is conducted, cast doubts on recent claims that a mistake may have unleashed the coronavirus on the world. Okay, this is maybe pretty important. The accident theory has been advanced by the Trump administration in recent weeks, so we can start to see the political bias sneaking into this article here. So because Trump advanced this, is NPR going to be against it now? And are we going to get a slanted article that's maybe not all the way on the up and up because of that angle? I hope not. Let's read on. Trump promised a very thorough examination of events, but after corresponding with 10 leading scientists, well, that certainly sounds authoritative to me, who collect samples of viruses from animals in the wild, study virus genomes, and understand how lab accidents can happen, NPR found that an accidental release would have required a remarkable series of coincidences and deviations from well-established experimental protocols. Well, that sounds pretty definitive, right? Let's keep reading. Rather, the experts interviewed by NPR all believe that the virus was transmitted between animals and humans in nature, as has happened in previous outbreaks, from Ebola to the Marburg virus and with other known coronaviruses such as SARS and MERS. Well, making a good point there. The real risk is in the wild, in the way people interact with wildlife around the world, says Peter Daszak, president of EcoHealth Alliance in New York City, a group that researches the origin of pandemics. That is where we need to be focused if we want to really do something about preventing the next pandemic, says Peter. Despite the evidence, misinformation about the virus's origins continue to proliferate. For Daszak, who has worked on other outbreaks, the pattern is all too familiar. Every time we get a new virus emerging, we have people say, this could have come from a lab, he says. What's unusual about this outbreak, he says, is that senior officials in both China and the U.S. have traded accusations that each nation is somehow responsible for the virus. It's a real shame that the conspiracy theories can get to the level they've got with policymakers, he says. Daszak says the time for finger pointing is over. We have a bat virus in my neighborhood in New York killing people. Let's get real about this. All right. All very authoritative. You want to know what my problem with all this is? You can read the entire article, and nowhere in there is there any sort of a disclaimer that says this gentleman, Peter Daszak, here's from October 2018, look at this. My turn to talk, summing up 4.5 years versus productive collaboration with Shengli Shi in Wuhan. That's the bat lady. That's the woman who was in charge of collecting all these bat things and experimenting on them here in the Wuhan Virology Institute. Wait a minute. This guy's got 4.5 years of productive collaboration with the bat lady in Wuhan. And all of a sudden, he's being cited as an expert who's basically saying it's conspiracy theories. It couldn't have come from a lab. I say so because I'm an authority on this. Well, that's fine. But I think you should point out that not only does this guy know this woman, but he's written papers with her. Here's one. review of bat and SARS. This is from 2006, so even more than 4.5 years. 2006 to 2018, I'd call that 12 years, Peter. Or maybe this one. He's also in 2015, another article. Or this one, another big article in Nature that came out in 2013. Or this one. Here's another article with the bat lady here. And where is he? I'm pretty sure. Yeah, there he is, right? And so you can look here and see that the Wuhan Institute of Virology right there. So Peter's done a lot of work with the very place he is saying authoritatively there's no chance that this virus could have come from there. You know what? Maybe that's true, but I got to tell you, from a fact-check, media check standpoint, you just got to report on those conflicts of interest, because when people find out about them, it damages that trust just a little bit further. In fact, I'm going to suggest that we're a little too far down on this side of things compared to this side of things when major conflicts of interest are not being reported on. And this goes both ways, not to pick on just NPR. I found a lot of these lately. I did it with the Stanford study and the Wall Street Journal, not disclosing that one of the principal authors was writing about that study as if it was this amazing thing that the authors, some other researchers had come up with. Failing to disclose conflicts of interest just violates every principle. Why? Because people are people. People talk their book. Peter may be consciously or unconsciously very worried about the fact that his research may have contributed to the release of a virus that's smashed across the world. And if there's even a slight concern of that, of course he'd be defensive about that, consciously or unconsciously. Anybody would. I get that. It's just part of being human, right? So it needs to be disclosed. Very easy to unearth, NPR. Super easy. It's called Google. It took me seconds to pull all that stuff up. All right. Unhelpful science. This would be the New York edition. So the headlines splash out: hydroxychloroquine, no effect on, seriously ill. Uh-oh. Preliminary results on a study on hydroxychloroquine in New York showed that the antimalarial drug had no effect on critically ill coronavirus patients. All right, I don't have to read anymore. You know why? Because we already knew that. We already knew that hydroxychloroquine does not work on the already seriously ill. So thanks for reconfirming that. That's awesome, but not terribly helpful. And by the way, just so you know, if you went over and you wanted to use Zovirax and you wanted to use it on shingles, you would read in there, and you know what they say about this antiviral? Treatment should be initiated within 72 hours of the onset of lesions. Thank you, Sandpuppy, over at Peak Prosperity, for pointing out that little factoid to me, so I dug it up. And in clinical trials, the greatest benefit occurred when treatment was begun within 48 hours of the onset of lesions. Of course, this is how antivirals work. You want to stop the virus from getting a foothold and replicating and doing whatever damage it's going to be doing. Okay, so again, if we wanted to, let's not even to improve, improve the VA study to let's see, conduct a hydroxychloroquine study. Yeah, this is what we would do. We would make it a randomized trial, full stop, of course, treatment begun early. Otherwise, don't bother. But as soon as COVID diagnosis or upon appearance of suggestive symptoms, if you can't wait for a test to come back, if you live in a test deficient state or country, some of us do, go ahead and get that started early. And of course, you want to get that zinc included in there. And if you're at all worried about the fact that azithromycin and hydroxychloroquine both have slight heart effects and that those may synergistically be a bad thing, especially in people whose hearts may be getting attacked by this particular virus, then don't include the azithromycin if you don't want to, right? Or only include it for some but not others, all that, but we'll leave that up to the clinicians to figure out who should get it, who shouldn't get it, all of that. But as long as they figure out how to get it to them early, that's all we want to see. Just get it there early. All right, media check, photography edition. Here was a really nice series done by, I believe this is in Czechoslovakia. No, I can't remember with. Oh, no. I think this was in, this is Dutch, right? I think that's it. So I think this is from the Netherlands. So this is the photography edition. And of course, you can't really trust things in the media, but this is interesting. So one photographer went out and took pictures with a telephoto lens from a nice long distance away. Look at that. Look at these people all standing in line like that, not obeying social distancing. I guess those Dutch people just don't care. Oops. Here's the same picture taken with a wide-angle lens from a different point of view. You can see here's the man in the green jacket. He's standing right here. Here's this woman. She's standing right here. Here's this woman with a strap across her chest, she's standing right here. The dude with a hoodie, he's way back here. There's somebody in between we can't even see because of the angle of the shot. So at any rate, this obviously gives a very different impression from this, right? That's like, oh my God, they're so crowded. And we got, oh, and they're being totally normal. Oh yeah, here's the second set of shots they did. You look at this one, you're like, oh my God, people walking by with their babies and they're all crammed in together. Oh no, that's just awful. Until you look at the wide angle shot, you're like, oh God, this guy's got lots of room, right? So at any rate, just watch out for those, for the media shots. They are often very, very misleading. All right, lots of people sent me this. There's the two doctors, and they had a video where they basically said, look, based on our numbers, a very, very significant number of people have already gotten this disease. They've already been exposed. And based on those numbers, that means that the fatality rate, the infection fatality rate, or IFR, as well as the case fatality rate, which is the CFR, two separate numbers, those are really going to be very low. And so here's the numbers that they went with. Look at this. This is text pulled from their videos. So if you look at California, these numbers are from yesterday. We have 33,865 COVID cases out of a total of 280,900 total tested. That's 12% of Californians were positive for COVID. So as you guys know, the initial models were woefully inaccurate. They predicted millions of cases of death, not of prevalence or incidence, but death. That is not materializing. What is materializing is, in the state of California, is 12% positives. You have a 0.03 chance of dying from COVID in the state of California. I think that's 0.03%, in which case that would be 3 out of 10,000. That's not a 3% chance. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work? 96% of people in California who get COVID would recover with almost no significant sequelae or downstream effects, or no significant continuing medical problems. All right, what's the problem with this? They've extrapolated to the entire state from the number of people who tested positive out of those who got tested. Now, as you know, to get tested in California, it's still kind of a tricky thing, kind of hard to do. You have to really forcefully do it and go in. So the people who are getting tested, it's not a random sample. The people who are getting tested in California, by definition, are those probably with the most serious chance of having the disease or already presenting with quite serious symptoms. So you can't take the 12% of Californians that tested positive out of the total tested and then say, ergo, therefore, 12% of all Californians have already got this, which then we can translate into a chance of dying. That's not how this works. That's not how any of this works. That's not even remotely how any of this works. Let's go on. We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. No, that's not what we do. That's actually not the case. You have to know what the sample is that you're drawing from, and then extrapolate from there. So if I went to the racetrack and I decided to sample amongst all the jockeys there, and then I extrapolated from that data, I measured them, I tested all the jockeys, and then I extrapolated for the entire community, I'm probably going to get a pretty bad result for the average height of humans, right? The initial models, to continue here, were so inaccurate, they're not even correct. That's tautologically accurate. And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. In New York, the ones they tested found 39% positive. So if they tested the whole state, we would indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most we have versus a predictive model that's been nowhere in the ballpark of accurate. Okay. So they're saying, look, the models have been bad, so chuck those. We'll just go with what we got and use those instead. But again, you can't do that. That's a false equivalence. You can't just take the 39% positive rate out of New York and extrapolate it to everybody in New York. That would be totally inappropriate. This is called Statistics 101. In fact, this is the first day of Statistics 101 where they talk to you about sampling And they put that out of the way so that you can move past the sampling into the math, which is what statistics is all about. You can't use the samples that come out of testing in hospitals as something that you extend across the entire population. It's so inappropriate that I don't even know what else to say about that. All right, continuing. How many deaths do they have? 19,410 out of 19 million people, which is a 0.1 chance of dying from COVID in the state of New York. Okay, this is not how it's done. You can't do it that way. But the end I would add to this sentence is, of course, even if we were going to use this bogus methodology, we would say, so far, right? You have a 0.1 chance dying, 0.1% chance of dying from COVID in the state of New York. So far, right? But you can't do it this way. This is not how it's done. You can't take the people who present at a hospital who are presenting for a reason, test them, and then extrapolate to everybody in the state. Doesn't work that way. If you are indeed diagnosed with COVID-19, 92% of you will recover. I don't even know what does that mean? 8% die? I don't have any reference for that number. I don't know where that one comes from. Is it saying 8% will, I don't get it. I don't have any data to back that number up. So anyway, I'll have to see where they might have got that. We've tested over 4 million, which gives us a 19.6% positive out of those who are tested for COVID-19. So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. No, you can't do it that way. You can't take people who show up and test positive in a hospital setting and then multiply by the whole population, come up and tell us how many people might have been exposed. That's just not how any of this works. I'm very sensitive, though, to the idea, which I think they did a bad job. So statistically, this is a horror show. Mathematically, this doesn't hold water. Logically, it's not good. So from these may be great doctors, but from a statistical or an epidemiological standpoint, they're way out of their comfort zone and ballpark on this stuff. So that's not good. I am, however, very sympathetic to the idea that, we need to have this conversation about, does it necessitate really shutting down the economy? Because remember, yes, we want to stop the pandemic and get the R0 below 1. I think we're there at this point in time. Yes, we want to keep the hospitals working. I think we've done that. The question that's being addressed, which is important, is maybe we haven't done such a good job over here keeping the economy going. Maybe we've been overly, focused here and here in a lot of countries. Maybe not all, but in a lot of them. And of course, this leaves behind the entire notion that some countries have managed to keep all three balanced, right? So where would we turn to, for example, to how to do that? Oh, I know, Taiwan, Kuwait, Bahrain, possibly Sweden, although, we'll have to watch the next couple weeks to see how their deaths mount over there. Singapore, even though they've got cases coming up, I think they've done just a fantastic job there. South Korea, all that, right? So there are countries that have managed this to some extent and other ones that have done a very poor job. An example of countries that I think are doing a poor job on this side of things might include Ecuador, Chile, places like that. But at any rate, this balancing act, I'm very sensitive to the idea that we need to spend more time over here on this one and figuring out how to open these things up. But we should be smart about it, right? Not dummies. Dummies are all those people who showed up in the United States at these protesting, the shutdown rallies, standing too close together. Nobody's got a face mask on. That's just being dummies about the whole thing. If all those people had showed up with proper distancing and face masks and said, "Hey, listen, we're not dummies. You, the government, can open this up because we'll be smart about this and we will maintain all appropriate distancing and everything like that." Because remember, to avoid, it's not just about avoiding becoming infected yourself. It's also about how to avoid infecting others, right? That's a big part of this whole thing. Those crowds of people smashed together without face masks on shows them not being concerned about either of these two things, being infected or infecting others. Both of those are irresponsible, and it's going to lead to more of number 3 over here and more of number 1. You'll get resurgences of things. So, hey, if you want to avoid being infected or infecting others, you have to undertake all appropriate social distancing measures. You got to do that, right? You got to avoid all gatherings, large or small. You just avoid them entirely. But once everyone is wearing a mask when out and about, this can be relaxed a bit. So if I was going to be organizing one of these things, I'd say, hey, let's everybody show up. Everybody make sure that, you can hold your arms out. No fingertips are ever touching. And everybody's got a mask on, and we'll make our points very clearly and sanely. And I think that would be an effective gathering. But jamming together and shouting that this is, you demand to be let out or let back into your cage, whichever way you want to look at it, is not helpful. And everyone in public has to wear a mask at all times, no exceptions. And no exceptions, especially sick people. And I hope that even after COVID passes, if or when it does, we maintain this for flu season, that when those people show up on the plane dripping and coughing and stuff, that they are now shamed appropriately for being the viral clue bags that they are, sharing their loveliness with everybody else in public or at work or other places like that. And we have to decontaminate all surfaces. This is something that they're doing in Hong Kong, South Korea, all sorts of places are doing it right. They're decontaminating surfaces all the time. And you do that before so that they can be clean before anybody touches them. And you wash your hands a lot, right? Oh, and you also remember that, remember we talked about how when people talk and the larger viral blobs tend to come out of their mouth and fall down within a meter or two? Where do they fall to? That's right, the floor. So your shoes and the bottom of your shoes, those are actually probably one of the largest vectors for picking up contamination, especially if you're in a place where people have been coughing, especially if you're visiting somebody at a hospital or you work in a hospital or something like that. So wash your hands and take off your shoes before you come into your house. Remember, if everybody's wearing a mask, then this has got a really good chance of being contained. All right. Interesting idea here, and got this in an email. Thank you very much for sending this to me. And I like this because this actually gave me a good way to look. I've been trying to think, how am I going to talk about this for a while? So this is a great article here. Coronavirus crisis reopens 150-year-old controversy. I love 150-year-old controversies. This woman, Karen Selleck, writes, I look at the coronavirus crisis differently from most people. To me, it's the reopening of a 150-year-old scientific controversy that much of the Western world has forgotten. French scientist Louis Pasteur is widely celebrated as the father of germ theory. And of course, I learned all about him in my biology classes. The idea that we become sick when our bodies are invaded by foreign organisms such as bacteria, molds, fungi, and of course, viruses. Although the idea had been circulating long before Pasteur achieved eminence, his laboratory work in the 1860s appeared to provide the scientific proof that had previously been missing. What's not widely known is that other French scientists working in the same field at that era held somewhat different beliefs known as the terrain theory. They believed that the most important factor that determines whether or not a person becomes ill is not the presence of a germ, but rather the preparedness of the body's internal environment, the soil or terrain, to repel or destroy the germ. I like this idea. It's actually both, right? It's the presence of the thing plus the terrain. I like this. What lives on after him, Pasteur, is the mindset clearly visible amongst most of today's medical professionals and healthcare bureaucrats that it is the germ, formerly designated SARS-CoV-2, the honey badger virus, that has to be tracked down, isolated, avoided, and eradicated. And that's all that matters. The terrain, to conventional modern thinkers, is nothing. For instance, on the Ontario government's website telling its citizens what to do about COVID-19, its advice consists entirely of measures designed to prevent people from coming in contact with the virus. Stay home. Wash your hands often. Don't touch your face. Maintain physical distancing and wear a mask when you have to go out. No mention is made of any measures individuals can take to ensure their immune systems are operating at peak efficiency, or, as the French scientists would have put it, their terrain is well prepared to mount a defense. It's almost as though the Ontario government doesn't believe human beings have immune systems or that they're of any use whatsoever. The only hope Ontario seems to believe is for a pharmaceutical company to patent a vaccine because that is the only way that human beings can defend themselves against a virus or acquire immunity. That's an important concept here. It's both. It's both your immunological health. We've been talking about that here on this channel for nearly 100 days now. And it's exposure to the germ. And remember, we wear a mask. One of the big reasons why we would wear them in the first place is because we want to protect ourselves from getting a large dose, a large inoculum, a large viral load as a starting point, because that's where things go bad. But as well, we want to make sure that if we do get a small viral starting load, we're starting with a very healthy immune system, which has both a humoral component, which is the antibodies in our circulating humor or the blood serum, as well as a cellular response, which are healthy macrophages and T cells and B cells and all of that, right? We'll be going into that, I think, tomorrow. That would be a great topic for tomorrow. All right, and so how do you prepare the terrain? You do things like this. Not medical advice, but there are a lot of things: quercetin, zinc, D3, vitamin C, all known to help advance and make your immune system top-notch. And if you do get exposed to viruses, NEC will help you fight the cytokine storm if you have one coming on. And elderberry syrup does a miracle job for helping me not get sick in the first place. It prepares the terrain, does that beautifully. All right, remember, special offer. You can still download our book, Prosper, that I co-wrote with Adam Taggart down here for free at that link right there. I want you to plant a garden. More and more people are starting to get this now and understand that what we're seeing out there in the world is broken supply chains and things like that. So please consider growing some of your own food if you can, and that makes a lot of sense. All right. Conclusions for today are nicotine may protect from infection, but smoking may make it worse if it strikes. So a little confusion here. We'll wait to see what the results of those studies are. All right. Media failing over and over again its most basic functions of disclosing conflicts of interest. Just do that. Do not do that. Okay. And of course, media images not to be trusted. And that includes videos, all that deep fake stuff and everything like that. Just keep your skeptical hat on anytime you're looking at an image, knowing that shots can be cropped, framed, telephoto lenses, all that stuff, right? I know you know that. I just bears repeating. There is still no definitive study on hydroxychloroquine. And guess what? Though we now have even more proof that providing a preventative drug after the damage has happened doesn't do anything. Yay. All right. Head and heart. We're getting to the hard part of this story now. I get it. People are frustrated. People want to get back to work, want to get back to life. The really frustrating part for me is that we could have done that months ago if we had just done what the gold standard pandemic countries had done. Adequate social distancing, consistent, clear messaging from the top at all time, face masks for everybody, right? And then being compassionate and isolating those most at risk. And that's the best we can do. Because guess what? With an R0 like this, there's really no chance of preventing people from getting it. Everybody's going to get it sooner or later. But the longer you can stretch that out, the better. How do you do that? You make sure as few people catch it as you can. You can't prevent it entirely, but you keep it within an acceptable band as slow as you possibly can. That's compassionate. That's what we do. So, and remember, you have a big role in helping those around you get through this, because this is going to be this is going to get a lot darker before it gets brighter. I think in this story, there's going to be quite a bit of downstream damage from the economy collapsing and taking hits, and as well, if you live in a country like I do in the United States, our fiscal and monetary elites can't think of what else to do besides reward themselves and their buddies in their revolving door relationship with, going from public to private service in Wall Street and back again. So they're busy taking care of themselves, and everybody else is kind of on their own. And that was the title of one of my daily videos a couple months ago now. And I still believe that's true. So at any rate, that's all I've got for you today. We're going to have a good one tomorrow as well. Have a great day. Talk to you again soon. Bye-bye.
Hi folks, Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.